The Monarch School was founded in 1997 to meet a critical need in our region to educate students who are diagnosed with a neurological difference. Before the Monarch School existed, many families were forced to send their children to residential, out-of-state schools. We've completed a major campus expansion that has allowed us to build 2 new buildings for our programs, doubling the number of students we're able to serve. Our tuition is expensive due to our low student-to-faculty ratio and the education and training needed for our faculty. We need endowment funds that will allow us to offer scholarships to those who can't receive our services without help. We also want to offer benefits to faculty so we can retain them. Monarch is successful because we're stubborn. We know that individuals with neurological differences have tremendous strengths. We know they can be credible, contributing members to their families and society. We give them the opportunity to develop in the areas of self-awareness and self-regulation, executive functions, relationship development, academic and professional competence. Everyone needs to feel that they're valued and a part of a community. Some of the tragedies in our country have shown what happens when young people feel disenfranchised. Our program is effective because we have highly educated, committed individuals. We train them to reach students with neurological differences. Our curriculum is designed to meet the learner where they are. We develop integrated learning plans that focus on self-awareness, self-regulation, executive functions, relationship development, and academic and professional competence. A multidisciplinary team of social workers, speech-language pathologists, psychologists, educators, and therapists work together to create a learning plan that is comprehensive and unique for the student. We measure our success with alumni tracking and a review of multiple assessments throughout the year. One of the most humbling metrics of success is to hear testimonials by students and their families about their experience and how we've changed and often saved their lives. Success can also be measured by the number of replication models we've developed. We have trained teams internationally and domestically, from Guatemala to Michigan. The expansion of our facilities offers us the ability to serve many more children and families. However, there are those who look at our beautiful new buildings and assume that we have all the necessary resources, which couldn't be more untrue. From our opening, Monarch is committed to offering scholarships. We've awarded more than $2.5 million in scholarships, but it isn't enough. We must turn away families every year. Families who found us only to learn they can't afford us is, as one parent said, like learning there is a cure for cancer, but not being able to afford it for your child. Also, people aren't aware that we serve individuals from age 3 to 30. We offer them a continuum of care through the school, clinic, therapy services, replication, and training and transition services. Our students created a teacher's guide for John Robison's New York Times bestseller, Look Me in the Eye, and the sequel, Be Different. We've received the Mental Health Association Award in 2010 for Outstanding Community Leadership and achieved gold-level leadership in Environment and Energy Design certification. We've also received national recognition in Newsweek for Kids Who Don't Fit In by Lorraine Alley. Opening a therapeutic day school in a city that had never had such a facility was a huge challenge for our founders. In the early years, it was challenging to establish professional and internship collaborations. Now our challenge is making sure we can fill our enrollment with families who can afford our services. With additional resources, we can continue to keep and hire qualified faculty at the ratios needed to be effective with the population we serve. We can offer substantial scholarships so that those who would otherwise go without our services can benefit from them. When we work with one child or young adult, We're not only improving their life, but also the lives of everyone in their family and community. We hear this over and over again from our families who are grateful. Monarch is determined to continue working to change the way people look at individuals with neurological differences. We want to help educators, mental health professionals, and all those that serve individuals with neurological differences to do so in a way that's proven to be respectful and successful. To do this, we need additional endowment funds for research, faculty training, and faculty benefits.